Good day everyone, I am Michelle Jane Sevilla from BSN 212E Group 20, and today I am going to perform a parenteral drug administration return demonstration using the subcutaneous, intramuscular, and intradermal injection. So prior to the conduct of the procedure, the first thing to do is to check the doctor's order on the patient's medication administration record, which is done to identify what kind of drug to be given to the assigned patient, to identify the drug's name, its dosage, route of administration, and time it is to be given. We also need to follow the 3 checks for administering medication. So read the label on the medication first when it is taken from the medication cart, second before withdrawing the medication, and third after withdrawing the medication. So to prepare the medications, we need to have syringes. So I have a tuberculin syringe for intradermal injection, insulin syringe for the subcutaneous injection, and a 25 gauge syringe for intramuscular injection. And I also have here aspirating needles, which is used to draw medication from vial and ampule. So we have a sterile water, which will serve as the medication vial used in this demonstration. And of course, we have a medication ampule. I have also a gauze pad, cotton balls, and a medication tray, and most importantly, a waste receptacle to dispose of used needles and syringes to avoid needle prick injuries. So this time, I'll be preparing the intradermal and subcutaneous vial medication. So after gathering the equipment needed, I'll perform hand hygiene to deter the spread of microorganisms and avoid cross-contamination. So now for the intradermal and subcutaneous injection, we will be preparing medication from a vial. So first, we'll have to read the doctor's order and compare the medication in hand. And now for the drug withdrawal, first mix the solution by rotating the vial between the palms of the hands, not by shaking. So this is because some vials contain aqueous suspensions which settle when they stand. And in some instances, shaking is contraindicated because it may cause the mixture to foam. And then remove the protected cup or clean the rubber cup of a previously opened vial with an antiseptic wipe by rubbing in a circular motion. And now to prepare the medication for the ID and SQ injection, we need to open the syringe and take it out. So remember to only touch the barrel and the plunger of the syringe to avoid contaminating the needle. And if the syringe is cupped, remove the cup first because we'll have to connect the insulin syringe into the aspirating needle. Then open the package of the aspirating needle and connect the barrel of the syringe to the aspirating needle. And also secure that and ensure that the connection isn't loose. Now uncap the syringe and draw air into the syringe, drawing air just with the exact amount of medication ordered by the doctor. And then carefully insert the needle into the upright vial through the center of the rubber cup, maintaining the sterility of the needle. Then inject the air into the vial. So injecting air will allow the medication to be drawn out easily because negative pressure will not be created inside the vial. Now invert the vial and draw the medication up to the exact amount of the medication needed, and then hold the syringe and vial at eye level to determine that the correct dosage of the drug is drawn into the syringe. And also eject the air remaining at the top of the syringe into the vial. So ejecting air gives an accurate measurement of the medication because a small amount of air will not harm the tissues. And if there is an air bubble inside the syringe, stop the barrel. So now we remove the aspirating needle and replace it with the right size needle that will be used in the actual administration of the medication. So we have already discarded the aspirating needle used into the waste receptacle to avoid needle prick injury. And now write the medication ticket, name of the drug, and the dosage so that we won't forget what medication was drawn into the syringe and we won't get confused. Now for intramuscular injection, we will be preparing medication from an ampule. So I'll just perform hand hygiene first to deter the spread of microorganisms and avoid cross-contamination. So first, we'll have to read the doctor's order in the AR and compare the label on the ampule to make sure that it is the right medication being prepared. So now prepare the medication ampule for the drug withdrawal. So inspect it and make sure it has no crack. So next, I'm going to lightly flick the upper stem of the ampule several times with a fingernail. And now take the alcohol prep and clean the neck of the ampule to help prevent contaminating and let it dry. Now it's time to break open the ampule. So take the clean gauze and wrap it around the head or neck of the ampule, and also break it off the top by bending it away from the body and away from others. So dispose the broken piece of the head and neck to the sharps container as well as your gauze. So we have placed the ampule on a flat surface. Then we'll get the syringe and replace it with an aspirating needle. So now remove the cup from the filter needle and insert the needle into the center of the ampule. So make sure to not touch the rim of the ampule with the needle tip or shaft. And after that, we're going to withdraw the medication from the ampule. So this time, we don't have to inject air inside the ampule, and also make sure that the ampule is on a steady flat surface using your fingers to hold it. And now we're going to remove and turn the syringe upright and flick the air to get the air bubbles out. And then push up the plunger slightly to the prescribed amount. And now remove the aspirating needle and dispose of it to the sharps container. And now connect the syringe to its original administration device and tighten the cup, and then place it over the medication tray until ready to administer the medication. So the first procedure that I'm about to perform is the intradermal injection. So intradermal injection provides a local and very little systemic effect. It is commonly used for tuberculous skin testing, but can also be used for allergy testing and local anesthetic. So the needle is inserted just under the epidermis at an angle of approximately 10 degrees. So the first thing to do is check the doctor's order for the patient's chart. And then I'll introduce myself to the patient and verify the patient's identity and also explain the procedure to the patient. So good morning, ma'am. I am Michelle J. Sevilla, your student nurse for today, and may I see your wristband, please? And kindly state your name and your birthday. Alright. Ma'am, today we will be doing the penicillin skin test. So what I'm going to do is to inject a small amount of the penicillin into your forearm to check if you're allergic to the medication or not. So the medication will produce a small wheal that is called a bleb. So a wheal is a small raised area like a blister. So you might feel a slightly prick as the needle enters your skin. So will that be alright? Okay, so ma'am, I'll be closing the door for your privacy. And also, I have already prepared your medication earlier. So closing the door will ensure the patient's privacy, and after doing that, we'll have to assist the patient in a comfortable position and then select the site for injection. Ma'am, can we sit? So the site for injection should be 3 to 4 finger widths below the antecubital space and here, and 1 hand above the wrist. So avoid using sites that are tender, inflamed, or swollen, and those that have lesions. So now perform hand hygiene and observe appropriate infection prevention procedure. Now cleanse the skin at the site using a firm circular motion. And then remove the needle cap while waiting for the antiseptic to dry. And expel any air bubble from the syringe. Alright, now grasp the syringe in your dominant hand close to the hub, holding it between your thumb and forefinger. And hold the needle almost parallel to the skin surface with the bevel of the needle up. And with the non-dominant hand, pull the skin at the side until it is taut. And then insert the tip of the needle far enough to place the bevel through the epidermis into the dermis. Then stabilize the syringe and needle. And then inject the medication carefully and slowly so that it produces a small wheal on the skin. And then withdraw the needle quickly at the same angle at which it was inserted. And then apply a bandage and do not massage the area. And then circle the injection site with ink to observe for redness or induration. Now remove the gloves and dispose of used items in appropriate waste receptacles to avoid needle prick injury and perform hand hygiene. And then document the procedure including medication given, dosage, time, route, and any assessment. And also evaluate the condition of the site for 30 minutes depending on the test, and measure the area of redness and induration in millimeters at the largest diameter, and document the findings. So document if the client had a positive or negative skin test result, and follow agency protocol on labeling of allergies. The next procedure that I'm about to perform is the subcutaneous injection. So it is the introduction of a small amount of solution by means of syringe and needle into the adipose tissue beneath the skin. So first, check the doctor's order for the patient's chart. Then perform hand hygiene to deter the spread of microorganism and observe other appropriate infection prevention and procedure like wearing gloves. So now I will introduce myself to the patient and verify the patient's identity and explain the procedure to the patient. So good morning, ma'am. I'm Michelle James Villar, your student nurse for today, and may I see your wristband, please? Again, state your name and your birthday. Alright, ma'am, today I'll be administering your medication through your parenteral route, and will that be alright? Okay, so I'll be closing the door for your privacy. And also, I have already prepared your medication earlier. So now, assist the patient to a position in which the arm, leg, or abdomen can be relaxed depending on the side to be used. And now I will explain the purpose of the medication and how it will help the patient. And I'll start administering through the subcutaneous injection. So I'll be administering insulin. So insulin is to control the blood sugar since the patient have type 1 diabetes. So ma'am, I'll be administering insulin. So this is because you have type 1 diabetes. Will that be alright? Okay. So now determine which site will be used and expose the potential injection site, and check the area for any bruising, inflammation, or edema. So the best site could be the outer aspect of the upper arm, abdomen just below the costal margin to the iliac crest, and the anterior aspect of the upper thigh. And also palpate the site and avoid areas that are tender. So, ma'am, can you please, do you feel any pain in your abdomen? And can you please relax your abdomen for me? Alright. Now clean the site using an antiseptic swab in a circular motion, starting at the center of the skin, circling outward. And then place and hold the swab between the third and fourth fingers of the non-dominant hand, or position the swab on the client's skin and above the intended site. And now pull the needle cap and hold the syringe into your dominant hand by holding it between your thumb and fingers. So using the non-dominant hand, pinch or spread the skin at the site, and then insert the needle quickly and firmly at 45 to 90-degree angle using the dominant hand. So pain is minimized by inserting the needle without hesitation. So when the needle is inserted, rest the non-dominant hand to the barrel and move the dominant hand to the end of the plunger and slowly inject medication over several seconds, holding the syringe steady. And then quickly withdraw the needle and then place the swab on the side and apply gentle pressure, but don't massage the area. So if bleeding occurs, apply pressure to the site with a dry sterile gauze. Now assist the patient into a comfortable position and then flip the medication ticket. And now remove gloves and of used items and appropriate waste receptacles to avoid needle prick injury, and then perform hand hygiene and assess the effectiveness of the medication at the time it is expected to act. And now document all the procedures, including medication given, dosage, time, route, and any assessment. The last procedure is the intramuscular injection. So it is the introduction of medication deep into the muscle tissue, wherein a large network of blood vessels can absorb it readily and quickly. So before anything, check the doctor's order for the patient's chart. And then I'll introduce myself to the patient, verify the patient's identity, and explain the procedure to the patient. Good morning, ma'am. I'm Michelle Jane Sibilia, your student nurse for today, and may I see your wristband, please? And can you state your name and your birthday? Alright. Ma'am, today I will administer an intramuscular injection. So your doctor has prescribed you with morphine sulfate to alleviate your feeling of pain, okay? And then select appropriate site for injection. So vastus lateralis and deltoid muscle are possible sites for intramuscular injection. And then examine the integrity and amount of patient's muscle mass and palpate the muscle area. So if there is tenderness, then it is not a suitable site for injection. And inspect areas for bruising, inflammation, and edema, and also use other site if present. And then assist the client to a comfortable position that will accommodate the injection site chosen and expose only the portion of the body. So I will position my patient in a sitting position. So now apply gloves and use anatomic landmark to find the site again. So for the deltoid injection, the first landmark is the acromion process. So this is found high up where the shoulder is, and it comes out like a bony prominence. And if you're gonna go about 2 fingers width down from that area. So here. So once we have the area, disinfect the injection site in a circular motion. Start at the center and move outward about 5 centimeters. And then hold the gauze pad between the 3rd and 4th finger of the non-dominant hand, and then uncap the syringe and hold it between the thumb and 4th finger of the dominant hand. So to give injection, what we need to do is we're going to use the Z-trap technique. So what this technique does is, number 1, it decreases the pain for the patient, but it helps prevent the solution that we're instilling from actually going in the subcu tissue. So place the arnold side of the non-dominant hand below the injection site and pull the patient's skin laterally about 1.5 inches, holding the position until you insert the needle. So do it quickly to cause the patient less pain. So you want to steady the syringe by holding it steady with our thumb and forefinger. Now aspirate by pulling back the plunger with your dominant hand to determine if you have hit a blood vessel. So if blood appears, it means that you have hit a blood vessel, and then remove and discard the needle and syringe and start over. If blood does not appear, inject the medication steadily and slowly. Then smoothly withdraw the needle, the same angle we had inserted it. Now place the gauze or swab over the injection site, applying a gentle pressure but not massaging the area. So if bleeding occurs, apply pressure with a dry sterile gauze until it stops. So this time, activate the needle safety device or discard the uncapped needle and attach syringe into the proper setup. After that, remove and discard gloves and perform hand hygiene. Then place the patient in a comfortable position and document the procedure. The time, the administration, drug name, dose, route, and the client's reaction. And then assess the effectiveness of the medication at the time it is expected to act. Ma'am, we are now done with the intramuscular injection, and I'm going to head out now, so you can take a rest here. So please avoid massaging the area that I have injected with the medicine, and thank you for your cooperation.